Okay, so we're going to do the medial sequence real quick. So we're going to start with the talus on the, or navicular on the calcaneus. So the first thing we want to do is get that calcaneus stabilized on the wedge. And then while that is stabilized, we're going to find where the navicular bone is. So we're looking for the navicular tuberosity, which should be about right there. Stabilize here, and then we can kind of apply a posterior force to that. Feel okay? Okay, next we're going to move the navicular, get that stabilized on the wedge, and we're going to go to the medial cuneiform. So this is going to be medial cuneiform on the navicular. And same thing. Okay? Mm-hmm. Next, medial navicular, or medial cuneiform, stabilized. And now we can do the first metatarsal on the medial cuneiform. Okay. And then from here you can go to the second metatarsal on the intermediate cuneiform. And then the third met on all three cuneiforms.
All three cuneiforms?
On the cuneiforms.
That was just
It just says on the cuneiform, so I'm assuming it's all of them. Does that feel okay? Mm-hmm. Okay, so that is the medial sequence. The lateral sequence, we're going to do the cuboid on the talus calcaneus. So stabilizing the calcaneus, bring the cuboid. So I'm actually going to put here. Actually get right here. There we go. That's better. And then apply a plantar force there. Okay? Now we're going to get the cuboid on the stabilized there on the wedge. Then next we're going to do the fifth metatarsal on that cuboid. And then next we have the fourth metatarsal on the cuboid. Should probably get a better position for my thumb, but it's going to make do with it. You feel okay with that? Mm-hmm. Okay. Okay, so keep in mind that all of these are plantar forces when you're doing these sequences. And then there's a distraction at the base of the phalanx. So that is good for, that's a joint play for all MTP motions. So essentially, I think that what you do here is you, this is the one where you distract here and then push down the intermediate. So we're going to use find the intermediate cuneiform, stabilize the intermediate cuneiform with the wedge. Come back a little bit, right there. Okay. So we're going to stabilize there, and then, actually, right there I think is good. We're going to apply a plantar force on the intermediate cuneiform, and then a distraction force along the second metatarsal. So you kind of have to just grip it the best you can. So it's kind of a 2-in-1 motion. So down and out. And that. So I'm pushing down with this, pulling out with this. Something to that effect. Okay, and then plantar glide of the base of the phalanx. So I'll look for the first MTP joint. I think that's it right there, right? First MTP joint.
What, the phalanx?
Yeah. Oh, phalanx, okay. Never mind. I'm thinking of TMT, never mind. Okay, so apply there. So we're gonna do a plantar glide. Feel okay? Oh, and make sure that, find that loose pack position here. So in this case, it's about 20 degrees of planar flexion for the first MTP. So you do that, then you apply your plantar force and come up. That plantar force helps with plantar flexion. Then if you want to do a dorsal glide, kind of pull up and then back down. And that helps with dorsiflexion. And then the loose pack position for the other toes is slight plantar flexion. So same thing, do whatever you need to do there. Then next you have medial and lateral glides of the base of the phalanx. So let's say you had Hallux Valgus. What you can do to correct that is, why am I blinking? Is it a medial glide of the first MTP, right? Okay. Yeah, so it's a medial glide of the first MTP. Yeah. So I'm trying to figure out, remember how to do this. So it's kind of, is like that, right?
Yeah, just bring it over this way.
Like that?
Just bring it this way.
Okay. So I did the opposite side. That was a lateral glide. The lateral glide is good for a deduction of the first and second MTPs in relation to this midline. And lateral glide for these would be good for a abduction. It's the other way. The medial glide would be good for a deduction of these and a abduction of these. And so with that, you're saying kind of bring it like this way? Okay. So I'm stabilizing here. And yeah. Okay. Pretty simple.
Right here.
Okay, let's try that again. So we stabilize here.
Really gotta stabilize. Not so much the whole foot, but
Just right there.
right there. Gotcha.
Okay, got it. And then that's a medial glide. Okay, and when you're thinking about glides and accessory motions, think about your body's midline. Osteokinematic motions are in midline to your extremity. Okay, and then just a few more here. Unicondylar glides of the second and third phalanx. So it's a joint play for the PIP and the DIP. So what we say it was just like a rotation?
Stabilize.
Okay. Stabilize there. Like that? You do the same thing with these, right? Or okay, we'll miss that another time. And then metatarsal heads, dorsal and plantar glides, are joint plays for functional gait. And then lastly, you have the dorsal and plantar sweep of the met heads. So this one, what you're going to do is you're going to be right here, and you have some movements that will help flatten the arch and movements that will increase the arch. And either way, these are joint plays for functional gait and for both dorsal and plantar flexion of the MTP joints. So we're going to do I think a dorsal sweep is where you flatten the arch. I don't know, I'll have to look that up to be sure. What's that?
You want plantar?
This is the plantar then. Okay, I can't remember, but to look that up. So, plantar and dorsal. Plantar. You feel okay? So you're kind of like using your elbows to get that extra movement there. That's it for that.